Well, new tonight, criminal charges announced today tied to alleged schemes to defraud Medicare and Medicaid. There's a lot to this story. The charges are part of the DOJ's National Healthcare Fraud Takedown.
Yeah, the U.S. attorney here says 4 people were charged in Nebraska. 50-year-old Angie Albert, 51-year-old Brent Conway, both from Oklahoma, charged with conspiracy to commit healthcare fraud and money laundering. It's in connection with a scheme to bill healthcare benefit programs for services not rendered and to overcharge for medication. According to the release, the false claims submitted to Medicare and Medicaid resulted in more than $975,000 worth of overpayments. 67-year-old Phyllis Rooney is from Hawaii, charged with false statements in connection with health care services related to mental health counseling services she did not provide. According to the U.S. Attorney's Office, it cost Nebraska Medicaid more than $92,000. Another defendant, Cassie Wigington of Omaha, is accused of health care fraud in connection with a scheme to submit fraudulent claims to Nebraska Medicaid. Wigington is accused of billing products that patients never got, leading to the submission of fraudulent claims to Nebraska Medicaid and other insurers, all of that totaling $445,000.